In this video, I am going to demonstrate 10 exercises that you can use for tennis elbow, but you shouldn't be using all of them. Some of them may actually make your symptoms worse. So yes, I will demonstrate the exercises, but I'm also going to explain how you can decide what exercises might actually work for you and also how you can monitor if they're useful or not. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. Have a look at the description of this video if you want a link to our website. Like I mentioned at the start, not all of these exercises will be useful for you. So the 3 things that you can use to decide what might work include what stage of recovery or injury your tennis elbow is in, also how sensitive it is, so how likely is it to flare up with certain type of exercises, and thirdly, do you have anything else going on? Do you perhaps have a neck injury or radial nerve irritation that's contributing to your tennis elbow pain? It's natural to feel that you want to be doing something when you're injured to help your injury recover more quickly. But depending on the stage of injury your tennis elbow is in, doing nothing may actually be the best treatment. I know the internet is full of people telling you that you must do strength training to get your tennis elbow better, and that is the correct advice. But for the later stages of tennis elbow treatment, not the early stages, if you jump in and start doing strength training exercises when your tendon has newly flared up and it's in what we call the reactive stage of a tendinopathy, then you actually just end up making it worse, because at that point, all it needs to recover is very gentle movement and just time to just calm down. Strength training is only needed in the later stages. Now, I've explained the stages of injury in detail in a previous video, and I'll link to that in the description. But if we look at a quick summary of it, basically it can be divided into 3 stages. The first is your reactive tendinopathy. And this is when your tendon's only been sore for a couple of weeks. So a few weeks, no more than 6. And during this time, the tendon can be quite painful and easy to irritate, and it's been overworked. So you don't want to add strength training on top of it, because it's just going to overwork it further. Then if your tennis elbow pain carries on past 6 weeks or 2-3 months, then the tendon usually enters the disrepair stage. Now what this means is that instead of healing, it's now changing the structure and it's starting to lose some strength in there. And if it carries on for more than 6 months or a few years even, then you will likely have some degeneration in that part of the tendon. So it means that the structure has fully changed there and is not as strong as before. But the important thing to remember is it's only a small portion of the tendon, so the rest of the tendon is still nice and strong. But it can be quite painful and irritable, and the pain can be quite a lot more than what the actual tissue damage is. I've made a whole video as well about the different types of treatments. All treatments, not just exercise, that's the best for different stages of injury. So have a look at that one. I'll also link to that in the description of this one. When you have tennis elbow, you can expect to feel some discomfort and pain when you do your daily tasks as well as your exercises. But the research is quite clear that tennis elbow exercises and treatment in general works best if it doesn't increase the patient's pain dramatically above what they normally experience. So we find that our exercises work best for our patients if the patient only feels a bit of discomfort while they're doing the exercise, and it doesn't increase their pain dramatically within the 24 hours or later after they've completed the exercise, and any increased discomfort they feel also calms down within to their normal levels within the 24-hour period. Now, if we find that actually the exercises did cause a significant increase, because you're not perfect with your exercise prescription always, then it means that the exercise likely needs to be adjusted. And that can be that either it needs to be a different exercise, but sometimes it's just about how many repetitions they did, the amount of resistance they used, or the weights they used. There are plenty of different ways to adjust the exercises, but it's not okay to just carry on with exercises that keeps on really aggravating your pain all the time. So a niggle level or bit of discomfort is okay, but it's got to calm down quickly. But if it's significant increase, then you actually have to adapt the exercise to not be that much. The 10 exercises I'm going to show you can be divided into 3 different categories. And the first is stretches. That's going to be stretches for your muscles that attach into the painful area, as well as stretches for your shoulder and your neck. Then also neural mobilization, which means it's exercises that helps the nerves in your arms slide more freely. I'll explain why that's needed in a minute. And then finally, strength training exercises that help to restore the strength in the injured tendons again. I've also written out all of these exercises in a blog post. If you really want to study how to do them properly, have a look. I'll add a link to that blog post in the description of this video for you. So if we think of it, it's the muscles that does this action, lifting the wrist up, that attach to the tendons, that is causing your pain. So if we want to stretch it, we have to bend the wrist down and extend the arm. And I'll take you through that in a minute. Now, you can start with gentle stretches, or you can actually have more stronger stretches. But if you're already flexible, you may not even feel a stretch in this. The important thing to note is that it's okay to feel a bit of a pull where the tendon is, but it shouldn't be very painful, and it should not increase your pain in the hours after you've done that. Okay, so if we look at the gentle version first, you want to have your elbow bent to 90 degrees, so it takes some of the stretch off the muscle and the tendons. And you're going to make a gentle fist, pull the fist down, and then just a little bit to the outside. So if I show that from the front, it's down and a little bit to the outside. And you're using your other hand to do that stretch. So what you should feel with this is a gentle stretch in this area. If you don't really feel much, you can make it a stronger stretch, and you do that by simply extending the elbow a bit until you feel a stretch in this area. Now, if you're feeling a gentle stretch, that's fine. You hold it for about 10 to 30 seconds. I would always start with fewer or a shorter hold if you've got a sensitive tendon, and build up to longer holds. And after the 10 seconds, you just move your wrist and everything a bit and go back into it. And you can do about 3 repetitions 3 times a day. That's for the gentle as well as this one. If you don't feel any stretch when you do that, then it just means that your flexibility is not the issue, and it's not going to be an effective exercise for you. So you need to do something else. If it causes strong pain, see if you can adapt it. So go back to the easier position. Maybe don't make a fist, just have your hand open when you push it down. If it still continues to irritate it, you may simply not be ready for this exercise, and it's not the right exercise for you. You can usually start with this exercise even in reactive tendinopathy, so quite early on in your rehab, but just be gentle and make sure that you check the 24-hour response to this, that you're not actually making it worse by doing these stretches too often. Why do we want to include stretches for the neck or the shoulder girdle when you've got a tennis elbow? Well, your radial nerve runs really close to the tendons that's affected with tennis elbow, and the radial nerve comes all the way from the neck. Now, if you have a neck injury or a shoulder injury, or it's just really tight and stiff, that can affect how freely the nerve slides when you're moving. And if it can't slide properly, it can really irritate it in that area. But vice versa, if you've got long-standing tennis elbow, that can sometimes irritate the radial nerve, and that irritation can cause everything else to become tight. If you have a proper neck injury or back injury, like a disc injury or shoulder injury, that can also affect everything and the tightness you feel there. But if you have a more serious neck injury or a disc injury or a proper shoulder injury, the stretches I'm showing now may not actually be right for you. It's much better to follow your physiotherapist's advice on what you can do, because otherwise it may make it feel worse. The first stretch you could do is a double chin stretch. Now, it's not a very sexy stretch. It involves you literally just making a double chin, and it's not looking down. It's pulling the chin straight back in and pushing the top of the head up to the ceiling. And you want to feel a gentle stretch at the top of your skull where it attaches to the spine as well as your neck. Now, it can often be better if you do it with a wall behind you, or even lying on the bed for a frame of reference, and you can feel that much better. But what I will say is, if you overstretch with this one, if you go too hard to try to really get it, it can often make things feel a lot worse. So be very gentle. And you only want to hold it for about 10 seconds at the point where you feel a gentle stretch, release it, move your neck, and do that about 4 to 6 times. You can do that more than once a day if you like. The second one is a full flexion, forward flexion stretch. So with this one, you also want to find a good sequence in the movement. You want to tuck your chin first, but now we're bringing it down, trying to roll down one vertebrae at a time and get your chin all the way down and hold it there. And you're going to hold it for about 10 seconds, and then unroll the spine and come back up. Now, if you're somebody who's on the stiffest end of the spectrum, you may be able to hold it for 20 to 30 seconds, but then you only do about 3 repetitions. If you're on the hypermobile side or more flexible side, 10 seconds is usually more than enough, and you can rather repeat it more times, so 3 to 5 or 6 repetitions even. But see what works best for your body. If you take it all the way down, you don't feel any stretch, it just means your muscles aren't tight in that direction, or that your range of motion is such that you can't get the muscles to stretch by doing that movement. Next up, we want to see if we can stretch the side muscles, so your trapezius, your upper traps, or your scalenes. And this is literally just bringing your ear straight down to your shoulder. Now you could angle it a little bit if you wanted. You could take it slightly back and down or slightly forwards and down, but I prefer to take it just straight down to the shoulder. And watch out that you don't lift this one up, because then you're not going to feel a stretch. You're meant to feel the stretch along this line. So you can even sit on this hand if you like. And you're not pushing as hard as you can. I'm just dropping my ear down until I feel a gentle stretch there. And you don't want to feel anything uncomfortably pinching or pain on this side, because then it just means you're squashing something that's not happy with life. And if you continue to squash it, you're going to make it angry. It's like pressing your thumb in a door and you keep on pressing on it. So remove that pressure and see if you do it in a slightly different way, if it's any better. You want to hold it for anything between 10 to 20 or maybe even 30 seconds. I really find this one is better just to hold for shorter and do more repetitions, anywhere 3 to 6 repetitions if you like, but see what works best for your body. I would always do it to both sides. It doesn't make sense for me to just be overstretching one side and not the other one. And you could do it more than once a day, but be careful, overstretching can also irritate things. So rather go for fewer repetitions first and fewer times in the day and see how it reacts, and always monitor how you feel later in that day. Next up, we want to stretch the chest. So we want to stretch the pecs and everything there. Now, you've got a few options. You can do active stretches where you move in and out of the movement, or you can just grab hold of something and actually keep the position. So let me show you the active version. For the active stretch, all you do is, I'm sitting forwards on my chair, so I've got space. You can do this in standing as well. And you've got your arms out in front of you, and you're just turning your arm and following your hand with your head as well and taking it back. And in that position, I like to take my hand back a little bit as well, so I can feel a stretch. It's a little bit of a neural mobs, to be honest. But you could also just be grabbing onto something in this position and gently pulling back. If you're doing the static one, you're going to hold it for 10 seconds again, or up to 30 seconds, and then let go and move a bit. But if you're doing the active one, you're moving into it and coming back, and moving into it and coming back. You can also alternate that you move to one side back, then this side back. See what works for you, see what you like best. There are many ways to do this. So static stretch, do 10 to 30 seconds. If you're moving it, 5 to 10 repetitions. The final stretch for the shoulders that you might find useful is a tricep stretch and a lat stretch. Now, yes, I know it doesn't stretch the muscles specifically where the radial nerve runs through, but it can just help with the general mobility around the shoulder joint and the thoracic spine. So all you do is you bring your arm up as if you're reaching to scratch your upper back, and you can gently pull it or push it even further. And you're looking for a stretch in this area or this area, depending on where you're the tightest. You could bring your other arm up into this position to make it even stronger, but it's absolutely fine to also just push it down there. Be careful that you don't compensate by just bending your back. You want to keep your tummy muscles in, that your trunk stays stable, and you're just pushing your arm back. And you want to look at what can you do on one side versus the other, because sometimes there's quite a big difference. Holding it for about 10 to 30 seconds, depending on what's comfortable for you. Watch out, you don't want a painful pinch in your shoulder, and you definitely don't want to feel, oh, my shoulder, I can't move it when you come out of it. If you're getting that, it may mean that you're either pushing too hard or the stretch is just not right for you. Neural mobilization exercises does exactly what the name says it does. It mobilizes your nervous system. And the nerve that we're most interested in here is the radial nerve, because like I mentioned in the previous section, it can sometimes get a bit stuck and then also cause pain in this area. If you have a very sensitive case of tennis elbow, Be careful of neural mobilization exercises. They can actually make it feel a bit worse at the beginning. So wait for your elbow pain to calm down a bit first. Also, if you have an injury to your neck or your shoulder, that means that the tissues around the nerve is swollen or pressing directly on it, like for instance a disc injury, I wouldn't do neural mobilization exercises during the early stages because the nerve just won't be free to slide. So you're going to stretch it and you're going to irritate that injury more. It works best if you first do the exercise that I demonstrated in the previous section, where you loosen off the neck muscles and the shoulder muscles, because then it can actually slide. If you try to do the sliding exercises and all of this is still tight, then you may just end up irritating it as well, because it's not going to be able to slide freely. So the sequence to events is you first do your stretches for your arm and your neck and your shoulder girdle, and then you do some neural mobilization. The movement we're going to do is you're making a gentle fist, then you turn your hand, so your top of your hand faces your side of your leg, and you're going to take your arm out to the side. Now, you're not lifting it so far that you've got to change your position that you're in. You're just taking it about 30 degrees or so until you feel a gentle stretch somewhere in the arm. And then if you bend your wrist up, you'll feel that increases the stretch. And also, if you take your head away, that's going to increase the stretch. Now, this is not what we want to do together. We don't want to stretch the nerve. We actually want to slide it. So whenever you bring the hand up, you give it slack at the top. So we're stretching it around this area. We're giving it slack at the neck. Then you're stretching it at the neck, but you're turning the hand the other way, so you're now giving it slack there. So we are doing a coordinated movement, hopefully, and you're sliding the nerve rather than stretching it. You only have to do about 10 repetitions of the movement of the slide into both directions. You don't want to overdo this movement either. It's one of those things where doing less is actually more beneficial than doing too much, because nerves are really, really sensitive to being over-exercised and can easily increase your pain. If you're finding this information useful, please remember to hit like and subscribe. It will help our channel reach more people. Then finally, we get to strengthening exercises. These are only needed if your tendon has actually entered the disrepair or the degenerative phase. If it's still in the reactive phase, strength training exercises is not what it needs, and it will actually make it worse. If you're very good at calming it down in the reactive phase, you may never need to add strength exercises because the tendon won't lose its strength or structure, and it can just calm down and you can carry on. But if it has been present for a few months or even more than a year, then yes, strength training exercises are likely something you need to add in. But it's really important that they are pitched at the right level for your injury. If the strength exercises are too intense, they may make your injury feel worse. If they aren't strong enough, you may not see changes in it. There are 3 types of strength training exercises that the research shows that can work for tennis elbow. And the one that will work for you will very much depend on your specific case. So you're going to have to experiment a little bit and see how your tendon reacts to what you're doing. The first one is eccentric only movements. Now, if we think of the muscles we want to be training and strengthening, are the ones that does this movement for the wrist, and they come at the top of the, or this part of the forearm, and attaches to the outer elbow. So this would be a concentric contraction, lifting it up, which means the muscle shorten while you contract it, and then slowly lowering it down. So it means the muscles lengthen while you're contracting it, is an eccentric movement. And then they also talk about isotonic movements, which is the combination of that. And then an isometric movement is where you're contracting the muscle, so you're holding the position, but you're not actually lengthening or shortening it. There's no movement, it's just contracting the muscle. So when you do a typical exercise with a TheraBand, this is how it would look. If we think of the eccentric only phase, it would be that you're lifting the hand up and you're holding it and then slowly lowering it down. That's the eccentric part to it. But research shows that you can also do isotonic exercises where it's up and down with that movement. And then it also shows the isometric ones where you just hold it against the resistance, no movement. That can also work. Now, in our experience, it can often flare our patients up if we start with exercises that isolate the wrist extensor muscles. They seem to tolerate exercise better when we just focus on good wrist control. So we're working those muscles isometrically, but we're moving other joints. So we're combining it into more functional rehab activities. Of course, that doesn't mean that we'll always avoid isolated exercises. For some people, that would be the correct thing to do. We are all different, and that's why it's important to experiment with things and find the best method that works for you. So for the first exercise, we're actually going to do external rotation of the shoulder, but we're going to keep the wrist in one position, so we work the wrist extensor muscles isometrically, and by turning the arm out, we're placing more strain on them. You really want to start with the easiest band you can find. So look on Amazon, you could get packs of 3 or 5 different strengths of bands, and I'll put a link to that in the description if you want to see that. And it's usually often the yellow band that you want to be using. So start with the easiest one you can find. And you want to have your wrist in a position like, if I can show you this way, it's not there, it's not there. People tend to like to bend it up like that. You want to keep it absolutely straight, okay? Elbow is at a 90-degree angle as well, and we're going to do that motion there. So you've tied the band to something. I've got a lovely helper holding mine today. And you side onto it exactly. It can help to make a knot in it and just close a door on it, then to keep it in place. And all you do is you tighten up your tummy muscles. You can do this in sitting even, and you just turn your arm out. You're not going for as far as you can. You just take it to where you can feel a bit of resistance on it and bring it back. So you're not even doing long holds to start with. We're just taking it out and slowly bringing it back in a good way. So that's the movement we do. And you can see my wrist is not bending back to get the movement going there. It's staying in a neutral position. So check what your wrist is doing, and you want to see that it stays in an absolute neutral line. It shouldn't be doing that. Start with only about 5 repetitions. Rest for at least a minute. I know it's more than what you likely need, but it can be really useful at the start, especially if you've got a sensitive elbow. And then you want to do 3 sets of that and see what the 24-hour response is. And if it's absolutely fine, the next session you can increase the number of repetitions until you get to 3 sets of 15. That's usually, if it tolerates that, it's time to increase the resistance and go up to the next band. Now, I really like the forward punch action for this because it strengthens the forward motion, which is one that we use often in the daily life. The key here is you're definitely going to need a TheraBand and a long one, and you want to hold your wrist in a neutral position the whole time. So it's not allowed to bend back or bend forwards. And what you do is you put the band around you, under your arms. There we go. And you just grip it comfortably, make a gentle fist, and you're punching forwards slowly and then release back slowly in. And you're looking at that wrist and you're making sure that it's staying absolutely level as you do that and bringing it back in. So to show you from the side, this is the action that we're doing. You're punching forwards and you're bringing it back. Punching forwards and bringing it back. So that's a nice easy one you can do. You can also tie it to something if you just want to do one arm at a time, but I just find it's less hassle to do it like this. Even if you do everything right, it's very easy to flare your pain up when you have tennis elbow and you start strength training exercises. There are 3 things that you can do to help prevent or minimize the risk of flare-ups when you start your rehab exercises. So the first thing is start with really, really light resistance and small number of exercises and small number of repetitions, just so that you can check the 24-hour pain response. And that's the second point. Make sure you monitor how your arm responds to the exercises, because if you get a significant increase in your pain in the 24 hours after, it means that exercise needs to be adapted. Now, either the exercise itself needs to be made lighter, or it may mean that you need a different type of exercise or fewer of them. And then lastly, and this is important, is you have to leave at least 1 recovery day between your strength training exercise sessions. People often make the mistake of overtraining or overworking that. Now think about it. If you're going for fitness into the gym and you want to train your leg strength, you're not going to go and do leg strength every single day, because that will lead to injuries because you're going to overwork them. Now, why would you do your tennis elbow strength training exercises every single day when tennis elbow is already an overuse injury? You need a recovery period after exercise to actually allow the body to react to the exercise and rebuild your tissues stronger. So this is the most important thing I would say after the get the load right, is leave enough recovery time. For some people, 1 day is enough. For some people, they need 2 or 3 days. So you're going to have to observe and see what your tennis elbow likes. So strength training wise, I usually advise patients that you do it maximum 3 times in a week with minimum of 1 day between the sessions. And then over the weekend, usually you have nice 2 days that you can recover. But it's absolutely fine if you find you can just do 1 session a week or 2 sessions a week, because it will also depend on what you do in the rest of the day. If you have a very physical job, it may not allow you to do that much strength training. And figuring out the right plan for you with the help of a physio can be really useful in those cases. It's worth keeping in mind that there are loads of different exercises you could be using for tennis elbow. So just because your physio hasn't given you these specific things I've demonstrated doesn't mean that the things you have is wrong. Monitor your pain and see how your elbow reacts over time. You're never going to see a quick fix. It's going to take a few months for the exercises to properly work, but you do want to see a steady improvement despite having flare-ups. If you're seeing no improvement or your pain is actually getting worse, things need to change. The most common cause for tennis elbow not getting better or actually getting worse is that people overdo their rehab exercises because they really, really want to get better. So if your tennis elbow is just carrying on and nothing is helping and the rehab exercise is really not making a difference, then sometimes just a period of complete rest can be super useful. So have a look at the videos I made about wrist splints and other splints and braces for tennis elbow, and also the other treatments that may be useful. I'll put a link to those videos in the description of this one. Brilliant. Hope you found that useful. Now, let me know in the comments if you've got any questions, and if you need help with your injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Please also remember to like and subscribe. It will really help the channel. Take care.